and welcome to another episode of FE Talks. This is the next in the series of workplace assessment tasks pertaining to Unit 001, Appendix 5. Without any further ado and without having to repeat that you have to carefully read all the instructions preceding this appendix as with all the others, let's get to the main answer. This is just to give you an idea. Of course, everyone's scenario, everyone's answers will be unique, different, original and authentic. This is just to give you a little bit of more clarity. So the name of the project, your C&D DNA Rehabilitation Unit, date of project commencement, you can put a date. Date of completion will of course be a few months later. Improvement action. One improvement action could be there will be regular one-on-one meetings with clients and their families. Another one, cross-council services will be consulted for improving routine practices to achieve our best possible practice. Number 3, more wellness and motivational programs. Or you could come up with any other improvement actions for your C&D. Related standard and criteria, clinical governance, comprehensive care, partnering with consumers, communicating for safety, medication safety. Our vision and goal? Our aim and objective is to create a safe and smooth transition for all our clients back to a healthy, balanced, regular, normal lifestyle with respect to their dignity, privacy and confidentiality, and to help them with their work and family. Quality improvement team, again you'll give the names of your team members and their designated, allocated, assigned roles and responsibilities. For example, Shelley, champion of the program, Sasha, program admin, Trish, external stakeholder from DNA counseling, Sophia, IT department data analyst, Jason, another program champion, Tanya, program admin, Nick Scully, community stakeholder, Liam, data specialist from accounts department. Problem analysis, the problems we discovered were that there was more procedure and less emotion, passion and motivation in the way the practitioners were delivering service to the clients. We want to increase the humanitarian aspect and bring more passion, hope and feeling in the way service is being provided. Therefore, we are training staff to give more customer-centric care. The evidence base, the stakeholder expectations were more result-oriented and based on visible data, facts and figures and stats, all quantitative data. Whereas our service philosophy is to create greater happiness, health and a smooth transition back to normal lifestyle. So we want to increase the humanitarian aspect in our service delivery. Next, mechanisms. Survey results, type of data, survey results. First, I'm going to read the column. What could be the different types of data? Survey results, member feedback, update and review results. Who will collect this? Put any name from your team. How often? Up to you. Every 6 weeks, every 3 months, every 4 weeks. Method of collection, survey monkey, emailed questionnaires, emails to all the internal and external stakeholders. Okay, on the next page you can continue quantitative data, qualitative data, put down the names, put down the frequency, 3 months, 6 weeks, survey monkey interview questionnaire. Next, stakeholder group could be counseling services, wellness and naturopaths. Frequency 6 weeks, 3 months, method of communication face-to-face, online, person responsible, put a name. Next, detailed action plan and progress report. Develop and implement a quality service delivery framework for DNA services. Goal statement, to achieve the highest and most humanitarian level of care, support and rehabilitation by implementing a framework for quality service delivery into our CD, DNA service, offering care, treatment and rehab to DNA affectees. Objective, physical well-being, diet and nutrition. Next, mental health counseling, social cohesion, adjustment, productivity, initiative, creativity, motivation. Strategies could be individual diet and nutrition plans, counseling sessions, group therapy, group activities, games, buddies, mentors, work activities, and specifically designed tests. By whom? Dietitian, psychologist, counselor, mentors, in house team. By when? Put a date. Measures of success for the first one could be weights and blood tests, measuring the weight of the patient and running their regular blood tests. Second one could be behavior analysis, interaction, initiative, problem solving skills, and then put a progress date, which should, of course, be well after the initiation date. Okay, so be careful. If you are doing it from a real world, your real world workplace scenario, of course your dates and everything, you'll be thoroughly practiced in getting everything correct. But if you are a student who's training to acquire qualification to be able to enter the workforce, you have to use common sense. So a program starts, the start date will be different, a review date will be different, a revision date will be different, and the end date will of course come later. So chronological order, remember. Okay, specific evaluation questions. Were the participants satisfied with the delivery of the program? Number 2, how do staff, community partners, and referring agencies feel about the program content and layout? Number 3, how did participants find out about the program and how many families, children, youth participated? Okay, action plan template. Action: complete overall mind, body, spirit rehab of our clients. Aim for holistic healing. Timeline: 6 weeks, 3 months. Up to you. Person responsible, program admin, champions, team members. Resources required. Premises, comfort zones, meeting rooms, presentation rooms, food and meals, recreation tools, educational tools, feedback form, paper, stationery, performance indicators, interviews, questionnaires, tests, feedback from families and healthcare professionals.